ladies and gentlemen. This is Mr. William Skuma Lamayina, a registered general nurse from the School of Nursing, Junior Nurses College, Kumasi. I'm a registered general diploma nurse, and I've realized that there are so many conditions that is confronting humanity, and I want to use this channel and this platform to take my time and to do some extensive teaching about certain pertinent conditions that are affecting the lives of human beings. I would like to first of all deal with this condition, hernia. Hernia. If we bring hernia in the Akan language, it is called nkwe. Nkwe. There's a difference between hernia and then hydrocele. Hydrocele is an accumulation of fluid in the scrotum, and then hernia is a condition whereby an organ protrudes through a weaker membrane. It is a protrusion of an organ through a weaker membrane. So let me do this example for us to get a clearer understanding. This is a paper, and for instance, let me take that this is the peritoneal cavity. So the peritoneum is in there, and this is one of the contents that is inside the peritoneum. And this paper is wrapped around the content, the inner content. So there is no way this inner content will be able to get out of the peritoneal cavity, which is covering the content, which is this marker. But there comes a situation whereby the peritoneal cavity, which is the content containing the items, becomes weak, very weak, and then you see that the organs will be able to penetrate through the weaker membrane. So there is a tear here, on the paper, and you realize that this pen or this marker is going through, is coming out through the tear or through the weaker membrane. That is what we call hernia. Herniation, penetration of an organ through a weaker membrane. So the membrane has become weak and it has penetrated through it. So sometimes you see people telling other people that come to me, I will give you some herbal concoction to take, and after that the hernia will go away, it will just vanish. No, it is never true. There is no concoction on this earth. There's no, we don't have any herbal medicine that can cure, hernia. No. So in defining hernia, we say hernia is a bulging of an organ or a tissue through an abdominal opening, or it is a protrusion of an organ through a weaker membrane. What are some of the causes? What causes hernia at all? It is caused by a combination of pressure through a weaker membrane. So for instance, someone coughs, persistent cough, and once as you cough, you cough persistently, you see that the muscles within the abdominal walls, you put more pressure and you have to force the inner content out. So if the peritoneum is very weak, it means that it's going to force the inner content through the, then it will dislodge somewhere. So that's one factor. And as we move ahead, we will take our time to elaborate on the types of hernia that we have. So that's one cause. We have lifting of heavy objects. As you lift heavy objects, it is likely that if you have a weaker membrane, because you are putting more pressure on the abdominal muscles, it will push some of the inner contents through the weaker membrane. Another thing is straining. As you strain, there are people, you see that they confront something like constipation, and once they get to the toilet, they have to strain severely, and as they strain hard, it means they have to push the content through the weaker membrane somewhere. Apart from that, persistent coughing, straining, and the lifting of heavy objects. As you lift the heavy object, much of the pressure is on the abdominal muscles. Okay, now let's look at some of the types of hernia, that we have. We have femoral hernia, You have umbilical hernia, you have incisional hernia, you have epigastric hernia, you have inguinal hernia, and we have hiatal hernia. So depending on where the organ pushes to, and then the name is given to that hernia. So for instance, if the organ dislodges into the scrotum, then it is called scrotal hernia. When it gets into the inguinal region, which is around this area, then it is called inguinal hernia. And if you get into the umbilical, then it is called umbilical hernia. So what are some of the signs and symptoms that manifest when someone gets hernia? One is bulging. You see bulging of the content at the points. For instance, if it is around the inguinal region, you see that the content of the organ will just bulge around that area. Then pain and then swelling. These are some of the cardinal signs. Then we have what we call differential diagnosis. Sometimes there are people suffering from hernia, but they don't know it is hernia. And there are other conditions which also is like hernia, but they are not hernia. Some of them are endometritis and the ovarian cyst, especially in women. And hernia also affects all groups of people, not women, not only men, but even children. It affects all group of people, being a child, being a female, or being a male. It's likely to affect us all. So what are some of the preventive measures that we can undertake? One of the greatest measures is maintaining a healthy body weight. As we gain much weight, it is likely that we develop hernia. And one of the preventive measures is to maintain right exercise. Then we take in more fiber and water. Then we do a lot of exercise to prevent constipation. We also have to reduce the lifting of heavy objects. If you do all these things, it means that we will be able to manage ourselves and to prevent ourselves from getting this kind of hernia. Let's look at some of the complications. When you talk about complications, we mean that if we didn't solve it at the beginning, where will it promote to? If we fail to solve or we fail to treat the hernias, then it will manifest to bowel obstructions, nausea and vomiting, strangulations, and then testicular pains, wound, and other things. The only treatment for hernia is surgery. Apart from undergoing through surgery, there's nothing that you can do. So if someone is out there deceiving you that he's having some concussion and that he'll give it to you, it is never true. The best treatment for hernia is through surgery. So the best thing is to go to hospital so that you'll be diagnosed by a qualified doctor. Then the doctor will undertake you through surgery. Let's take the diagnostic measures. You have physical examination. Once the content is bulges there, you just get to know it about it. You see it. It is physical and you see it. Another thing is abdominal ultrasound. Then we have computer tomography scan, which is called CT scan. Then we have MRI, magnetic resonance imaging.